Hi, I'm Mark Hindle, and I'm going to talk about patient empowerment and why it matters. Patient engagement for me is how we build patient agency. How do people become more active in their health and care? How do they stay well in the community? And when they need to access the health and care system, how do they navigate it? There's some building blocks for them to be able to do that. For example, how do they get access to the care system data around them and what's wrong with them? Or how do they find out what care is available to them in their community? So I'm thinking about hyper-local services, and that's possible by having the data available to the patient and to the clinician, and thinking about the experience of both parties and creating pathways between the two at a local level in the community. I think systems around the world have spent so much time thinking about what we can do by bringing together this data. Some fantastic progress has been made. Data sets that don't previously exist are now all together in one place. But what's the point of those data sets if you don't connect people to that data set, allow them to understand it, spend time thinking about difficult issues like access, literacy, and then knowing how and when people can navigate safely into the services you provide. So the next big leap we have to make is how can we support that transition of shared care records in real time. And if we think about it that way, then the shared care record brought to life is in the hands of the citizens and on the end of the wire to the healthcare delivery organisations. The first step is to get people connected, and so quite often, technology companies talk about how easy the technology is to deliver, and actually the contact sport of getting patients engaged is quite difficult. And so supporting our different regions to engage in that program of work of onboarding and nurturing people who want to show willing to get involved in their local community is something I think we as technology companies have a responsibility and the capability to do better and to prioritise. So once we've started to empower patients, the next thing we can start to think about is how do we make ourselves available to those patients digitally? How do we tackle some of the challenges around access? For example, with simple things, a digital front door that allows these patients to come to us when they want help, to stay well in the community, to navigate our services when they get sick, or even just to generally get advice as an alternative to using the internet to search for conditions. Concepts like digital front doors are ways in which we can use that engaged population we have to plug together to the services that we provide and start to think about how we manage the demand that they generate differently to how we have done traditionally.